Vicky DeBrinia does not have COVID, but her life is still in danger because of it. Everything's finally a go for Vicky's heart transplant. She cannot live much longer without it. But surgery is on hold now because hospitals are filling with COVID patients and there just is not a bed for her. So she waits. She doesn't have family, but she does have a friend fighting for her.
This is a backup infusion pump.
Michael Waters has watched his friend Vicky overcome impossible odds already.
Sweetest soul you'll ever meet.
He's believing she will do it again.
And she's just in a spot and she needs help.
Vicky was born with a rare heart defect. Most don't survive long.
And most of them don't live to be a year old. She's really, a miracle as far as that goes. And now she's, we're trying to get a second miracle.
Now, close to her chance to experience the fullness of life for the first time.
She's excited about getting a new life.
And she's hopeful that will happen sooner than later. Vicky will have her surgery at Emory University Hospital when COVID slows. She'll stay for a month, then a month of rehab. And with insurance even, it's still extraordinarily high cost. So her friends are rallying with a GoFundMe page. We do have a link on 11alive.com. Jennifer, it really just is one of so many stories that are an impact that COVID's having far beyond the people who are testing positive, and there are so many of those as well.
Yeah, and we are hearing more and more about the hospitals and the strain that they are under, and so it's these people who need other care that's even outside of COVID, and it's our healthcare workers that are fighting so hard on the front line. So this really is so interconnected, and that's why it's so important that we remember this as we try to adhere to those safety protocols.
Yeah, and hope that vaccine just keeps coming out faster and faster.
Yes.